In 2003, I built an AI algorithm for functional medicine. Not last year, not when everyone started talking about ChatGPT. Back in 2003, and I didn't build it because I could see into the future. I built it because I had a splitting headache every single day until I cured it with code. If that sentence is totally confusing and doesn't make perfect sense, don't worry. By the end of this video, it will, because what I finally realized is this: healthcare doesn't have a data problem. It has an understanding problem. And once you see that, you can't unsee it. This is the story of how a 15-page questionnaire, a splitting headache, and a full-time development team led to something the rest of healthcare is only now waking up to and realizing it desperately needs. My name is Dr. Jay Mahoney. I'm a board-certified osteopathic family physician, and I've spent the last 40 years trying to help people not just manage symptoms, but eventually actually heal. But this story starts long before I became a doctor. It starts with my dad and a part that kept breaking. My dad was a mechanical engineer, the kind who solved problems nobody else could figure out. His team was building something he eventually patented. There was this frustrating part that just kept failing, and his team did what the manual said. They made it thicker, more material, more strength, and it broke faster. My dad said, "Have you tried making it thinner?" They said, "Whoa, that's not what the book says." And he said, "Just try it." It worked. And that's when I learned one of my most important lessons of life. The manual only works when you apply it to the right problem. In other words, you got to apply it to the problem that's right in front of you, not something else. Our healthcare system has a manual too. It says, see more patients. Document, 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 document everything, and follow the protocol. But what if the problem isn't that we need more documentation? What if the problem is we don't actually understand the patient we're taking care of? That's the real problem. Healthcare doesn't understand the patient. So I went into academic medicine then. I thought that's where innovation lived. I lasted a year. After an internship in Corpus Christi, they asked me to stay and teach, and I loved it. I followed that up with a residency in family medicine in Flint, Michigan, because I really wanted to know everything it took to be the best teacher. Then I moved on to become a full-time assistant professor at the Texas College of Osteopathic Medicine, a place where I thought, boy, they're going to welcome these great new ideas. I tried to introduce advanced procedures like colonoscopy into the family practice curriculum, things that would really dramatically improve preventive care. And the response? Son, that's not how we do things here. Well, that's when I realized something that changed my career. Institutions don't reward better thinking, they reward conformity. And conformity is just another word for sticking to the manual. So I resigned. Because if the system you're working in won't let you practice the medicine you believe in, you don't wait for permission. You build a better system outside of it. I went into emergency medicine next. It felt heroic, amazing. And I didn't have to think quite as hard about the longitudinal problem. And I got good at it, really good. When someone's dying in front of you, you move, you act, and you learn fast. But even so, the heroic part kind of wore out, because the more I did it, the more I felt like something wasn't right. I wasn't creating health, I was managing crisis. And there's a difference between saving a life and changing one. The ER is reactive, and functional medicine is proactive. One deals with eliminating symptoms, and the other heals by understanding causes. So I shifted. I built a practice centered on a deep understanding of the individual patient. Insurance didn't so much care to pay for all that and pushed back hard. And Medicare pushed back harder. The whole system pushed back against it, but I'd found the work I was meant to do, and I learned something most doctors eventually feel. You can look successful inside the system and still know deep down you're solving the wrong problem. So I left insurance completely. I went into cash practice. No billing battles, no interference. And boy, it worked. I discovered patients will pay for great care when they experience it. But I still had a problem. Every single day, and maybe this isn't that funny, I kept getting this headache. Not from patients, but from the systems I was using to treat them. And if you've ever used those systems, any of the legacy EHRs and old school stuff, you know exactly what I mean. You walk in already dreading what's waiting for you. You walk into your office knowing you're going to look at a screen that looks more like an IRS form than a care plan. Endless, foolish clicks. Workflows built for accountants, not for patient care. And I used to think about it like this. If an employee behaved that way, you'd fire them on the spot. And yet, we tolerate it. That's when it hit me. The problem wasn't insurance. The problem wasn't time. The problem was that the system wasn't built to understand the patient. It was collecting data, but creating no insight. And when the system doesn't help you understand the patient, guess who does all the work? You. So in 2003, I decided to fix it, not because I was trying to build a company, because I was frustrated enough and curious enough to solve the problem. I hired a programming team, and we started with a simple idea. What if the patient could tell a system their whole story one time, and instead of generating clicks and clicks and paperwork, it could actually generate understanding, novel idea, right? Not more data, but actual clarity. What's actually wrong? Where's the dysfunction? Over the last 22 years, that system's been evolving. While the rest of healthcare focused on improving documentation, we focused on improving understanding. Because here's what most people don't realize. Functional medicine requires an uninterrupted train of thought. You're holding the patient's entire story in your head. Symptoms, history, labs, personality, and you're building a picture. And every interruption breaks that flow. More interruptions lead to more errors. More errors lead to worse decisions. Worse decisions lead to worse outcomes. So it's more than an admin problem. It's a clinical one. And once you see that, you realize that no amount of random clicks is ever going to fix it. Here's what happens when the system finally aligns with what you think. A patient walks into your office. Ready? And instead of starting from zero, where you go through that door and you don't really know the name or the problem, you already understand the story. Not just the symptom they came in for, but the patterns behind it. You're not guessing. You're not digging through notes. You walk in and say, hey, Bob, I know you're here for a headache and we're definitely gonna fix that. But what's really driving this is your gut. And for the first time, the patient feels known and understood, not processed. And that's what a great system should create. Not something you fight against, but something that works with you, not something that interrupts your thinking, something intuitive, aligned with your thinking. Almost invisible, because it's finally working, I might call it thinking, the way you do. You're not spending hours after the visit documenting what already happened, you're present during it. Because the system isn't asking you to do all the heavy lifting, it's finally supporting how you think, and that's the shift, from data to understanding, from documentation to insight, from reactive care to intentional care. If you're a practitioner listening to this, you already know the feeling. The system you're using doesn't match the way you think. And you've probably accepted that as inevitable. It's not. Okay, what happens when that problem goes away? Something really interesting. Practitioners stop burning out. They stop working until midnight, clicking away in documentation hell. They start building healthy businesses, not just surviving in practice. We're seeing nurse practitioners and functional medicine doctors build multi-million-dollar cash practices, not because they're working harder, because they finally have infrastructure that supports the way they practice medicine. Better outcomes, more time, sustainable growth. Not because they changed who they are, but because they changed the system around them. So here's the real takeaway. For decades, healthcare has been trying to improve documentation. Better records, faster inputs, more data. But that was never the real problem. The problem will be, the system doesn't attempt to understand the patient. That's not part of the plan. And when the system doesn't understand the patient, the doctor carries the load. And what we've been building for the last 22 years is different. Not just better documentation, better understanding. And once you have that, everything changes. The future of healthcare won't be built by better documentation systems. It will be built by systems that finally understand the patient. And the practitioners who adopt this first will define what modern medicine looks like. That's the shift, and it's already happening. If you want to see what that looks like in your practice, go to esprehealth.com and experience it for yourself. And if you're thinking differently about healthcare after this, and you should be, subscribe, because we're just getting started.